Okay, we're gonna go ahead and get started. Thank you all for being here. I know it's the last day of classes and cold, so I was not sure if we would have a lot of people, but thank you for being here. Just a couple things. I don't think we really have much. This is the schedule for next semester. We have a couple GB meetings. We also have our annual mental health and D&I meetings in there too. And then after spring break will be elections. And we'll explain more about that when it comes along, but basically the process for applying for executive board for next year, you'll submit an application to us, the EB will review it, and then we'll have elections as a whole general body meeting itself. You'll kind of come up here, do a little speech, and then the GB members will vote. So it's kind of a whole process, but we'll get more into it once it gets closer. So yeah. A couple more reminders. CFACE General Scholarship is due February 15th. Oh, sorry. And the Olympics are on March 20th. VMA usually does Olympics, but we also usually don't have a good turnout, so unsure if we're going to be doing it this year. But you can for sure still go, I think, and hang out there. And then also thank you all to who attended our SAVMA PVMA mixer last week. It was a lot of fun. We had a really good turnout. So yeah, thank you all to who came to that. Does anyone have any questions before we get started about schedule, elections, merch, anything? Yeah, sorry about our merch. We're figuring it out. Hopefully most of you who came tonight got what you ordered. If not, we're supposed to have the rest of it by the end of this week. And Michaela said she's willing to work with people if you want to get it over finals. If not, you can feel free to grab it next semester when we start back up again. But all right. Well, if no one has any questions, we will hand it over to Dr. Habing. Everyone can give him a warm welcome, please.
How are you all doing? Good. I'm Greg Habing. Adriana works in my lab. We do a lot of work with infectious diseases and dairy and calf production systems. So I'm board certified in veterinary preventive medicine. And I'll talk a lot about Salmonella Dublin, which is a particular pathogen we're focusing on. But I'll try to talk in more general terms about preventive medicine and disease prevention on production systems. As I go along, please stop me and ask questions. I very much appreciate the feedback and the questions. So this is me way back in the day when I was out practicing in South Central Pennsylvania, back when the camera technology was not very good. So I started out as a mixed animal practitioner, and I did dogs and cats about half the time, and then I was out in the field about half the time. So and most of that was dairy cattle. So I was driving around to farms in working with producers, both clinical medicine, fixing sick cows, um, but also preventive medicine. And so at this point, this is where I really appreciated the value of prevention, right? Because I would go onto a farm, they would call me to do a abomasal surgery or to look at a lame cow. But they wouldn't necessarily call me to discuss how to prevent these problems from happening in the first place. Right? And so some of the farms didn't understand the value of the veterinarians in terms of putting protocols into place, understanding husbandry, understanding practices so that they don't have those surgeries, that they don't have those lame cows, right? So part of my goal during practice was for farmers to appreciate the value of prevention and to pay for it, right? It's really easy to get them to pay for a surgery, really hard for them to get to, at that time, it was hard for them to pay me for an hour of consultation about prevention. That's changed a lot, right? A lot of production systems have consolidated. They're much larger, they're more data driven, they understand the value of prevention, and you really have an opportunity to do a lot of good there. All right, so just a little bit of an overview. So we'll use Salmonella Dublin as an example. Talk about that pathogen and Salmonella in general, how we can control it, and in other words, reducing new infections within the herd, and then the prevention part. So preventing the introduction of the pathogen onto the farm. So how many have heard of Salmonella? How many have had salmonellosis? How many don't want to admit it? So Salmonella is a very broad term, right? It's a very broad collection of microorganisms. So for most infectious pathogens, we have to differentiate between strains to understand that. You guys went through COVID, so you understand that, right? You knew that there were different strains of coronavirus out there and how important differentiation of those strains was. So one of the ways we can differentiate Salmonella is by serotypes. And each serotype has its own flavor of host range and ability to cause disease and the severity of disease, signs that it causes, how well it survives in the environment, how susceptible it is to antibiotics. But Salmonella Dublin is pretty unique. Salmonella Dublin causes really invasive infections in calves. So it's very good at crossing the intestinal barrier, causing bloodstream infections and infecting organs. So in the lungs, the spleen, the liver. So when a farm has an outbreak of salmonellosis, it's not a good situation. Sometimes we see 20, 30% mortality because of the introduction of the strain onto the farm. So this is just a picture of the intestines of a calf that was being necropsied. And there's a lot of hemorrhage on the surface of the intestines that was caused by that particular organism. So for salmonellosis, typically we think about diarrhea and a fever. For Salmonella Dublin, the primary presentation is respiratory signs. So that makes it very much unique from other strains of Salmonella. And it's zoonotic, so super important. So what I had showed, that image that I'd showed you before, the invasiveness, same thing is happening in people. So there's a lot of bloodstream infections and hospitalizations and deaths from Salmonella Dublin in the United States. And that is the primary reason why we are working on it in the lab, because it causes infections in calf production systems. The producers care a lot about it, but it's also transmitted through the food supply and causes disease in people, right? So that's why we are funded, is to reduce the prevalence of Salmonella Dublin on farms so that we protect human health, protect public health, right? That's the primary motivation. We work with dairy and calf producers. They're primarily interested in solving the problem on their farm and protecting their animals, right? So they're interested in working with us, but our ultimate goal is to protect public health. So we always caution producers about the YOPIs. Anybody know what that stands for? Come across that acronym before? The young, the old, the pregnant, the immunocompromised, right? So for individuals that are going to come into contact with these calves, there's lots of different zoonotic organisms. And if they fit into one of those categories, then You have to be really careful. Dublin is also unique because it causes latent carriers. So calves that get sick with Salmonella Dublin, but then recover from clinical disease can go on to become a healthy carrier and have the ability to transmit it on farms. So this sometimes happens in older animals, 1 to 2 years at higher risk. Identifying which animals are the healthy carriers is one of the research questions we're looking at, right? So we want to have a very good test for farmers to use to identify which calves are the latent carriers so they can take the appropriate precautions and prevent that sort of transmission. So detecting them is hard. So these are essentially the typhoid Marys of the farm, right? So they recovered from clinical disease, but then they go on to stay in the herd and then keep on spreading the organism around. Anybody heard of typhoid Mary? You know the story of typhoid Mary? Yeah, so what organism was that? It's caused by typhoid, right? Close. It's some Salmonella typhi, right? So confusingly, typhimurium is a different serotype of Salmonella compared to Salmonella typhi. Salmonella typhi is the cause of typhoid. I'm sure you've heard of typhoid before, right? A disease that we fortunately don't have to worry about too much in the United States. But this person, her name was Mary Mallon, I think. She was a cook, and she became a latent carrier for Salmonella typhi. And this was a new concept at the time, that somebody could be infectious but not showing signs of the disease, right? So new concept at the time. She unfortunately liked to cook for large groups of people, and wherever she went, like disaster followed, right? They eventually put her in jail because they needed to stop those infections. Not a very, very good intervention, but that's the story of typhoid Mary. And this concept is relevant for animal populations as well. In particular for Salmonella Dublin, we have individuals that are healthy and yet infectious. And so it's not easy for the farmers to identify those animals and take precautions because they're otherwise apparently healthy, right? Make sense? Questions so far? All right. So the other unique thing about Salmonella Dublin, amongst other pathogens, is that we can get transmission from mom to baby. So vertical transmission of those pathogens. So if the mama cow is a latent carrier, not a good situation, right? Because they can excrete the organism in the milk, and then the baby calf becomes infected. Calf goes to the nursery, breaks with clinical disease, starts spreading the disease around. Right? So, and again, identifying which animals are the latent carriers and coming up with a good diagnostic test for that is one of the focuses for our research. So this is kind of a model, right? So there's introduction onto the farm, there's excretion by an animal, the environment gets contaminated, produces new cases. I just realized you guys can't see my pointer. That produces long-term carriers. Those long-term carriers continue this cycle of infection on the farm. And as long as those carriers are there, the cycle generally continues on the farm. Some immunity that develops, and so clinical cases kind of go down, but there's always these recrudescent, occasional spontaneous cases that happened. And then, of course, these organisms can be transmitted through the food supply in meat or milk and then cause human infections. So our job as veterinarians and as researchers is to figure out how to break this cycle of infections and how to prevent this transmission through the food supply. So veterinary public health. I don't know, has anybody talked about veterinary public health in this meeting so far? Great. All right, so treatment for Salmonella Dublin, it's a bacteria, and you can treat it with antibiotics. Unfortunately, it's evolved resistance to most antibiotics that producers have available to use for Salmonella Dublin. So this is a laboratory report listing all of the different antibiotics, the minimum inhibitory concentrations and the interpretations, and you'll see a lot of R's there for resistance. And then there's other antibiotics that are not legal to use on farms that are really not available to farmers. And so because of this evolution of resistance, treatment becomes really difficult, which only emphasizes the importance of prevention. Yes, sir.
So that means susceptible.
The S does mean susceptible. Yeah. Yeah.
Those ones are those like the illegal ones.
Well, some of them are. Ampicillin, for instance, has an MIC of 2. Its interpretation is susceptible. This particular laboratory, you got to be careful, used a breakpoint to categorize susceptible as resistant from human literature, right? The concentration of 2 micrograms per milliliter in a calf is not achievable with the doses that we use. So it's effectively resistant, even though you get a report back that says S, kind of misleading, right? So if you go down the line, the only legal and potentially effective antibiotic would be ceftiofur. This one right there. So you've got one shot. So that Salmonella Dublin is super resistant. Makes a lot of sense, right? Why do you think Dublin would be more likely to evolve resistance than other strains of Salmonella? From an evolutionary standpoint. If you think about Darwin. So I've already mentioned that it's very virulent, right? And causes very severe disease. So an animal that has very severe disease on a farm, what happens to that animal? Gets treated with antibiotics, right? Much more often than other strains of Salmonella. So a strain of Salmonella Dublin that's evolved resistance to antibiotics has this huge evolutionary advantage, right? So when an animal gets treated with antibiotics, the susceptibles die off, the resistant ones remain, and then they can thrive in that environment without the competition from the other susceptible bacteria that were killed by the antibiotic. So because it's virulent, because it causes severe disease, it's more likely to be exposed to antibiotics, this bacteria, and then that Darwinian process, selection of the fittest, killing off the susceptible and allowing the resistance to survive just happens more often. And so you end up with these very resistant strains of Salmonella Dublin that, of course, then again, get transmitted through the food supply, cause infections in people, and then the physicians are left with very few choices to treat those resistant infections in people, right? Because the antibiotics that we use on farms are the same classes of antibiotics that are used by physicians. Does that make sense? Yeah, the antibiotic resistance, it's a whole separate talk. So we did some work in Ohio and Wisconsin at livestock markets. And if you guys ever get the chance, you should go to some of the livestock auctions, like the Sugar Creek Livestock Auction. Has anybody been to one of those before? Yeah, fantastic experience, right? You get to see a menagerie of animals, a lot of Amish buggies. Mrs. Yoder's restaurant has fantastic apple pie. And so they sell a lot of animals that go through there. This is a picture that we took of the calves that were born on dairy farms. The females, of course, grow up to be future milk cows. The male calves are surplus calves that will eventually grow out to be beef, right? They're often sold in auctions or through calf dealers, these male calves, and they're aggregated here. We worked with the Ohio and the Wisconsin Departments of Agriculture and looked for salmonella in the environments. And out of the 75 boot swab samples, so it's just somebody putting a boot swab on, walking around, and we cultured it out. In the 111 boot swab samples in Wisconsin, about 93 and 99% were positive for salmonella in this particular environment. The other samples that were negative, probably just didn't find it. It was probably there, right? The test isn't perfect. So salmonella, some type of salmonella is present in these environments. So here's the problem. These calves that are born on dairy farms are typically less than a week old, right? They're babies. Sometimes they didn't get sufficient colostrum, and then therefore they are immunocompromised. You have calves that came from many different farms that are aggregated in the same location. So you have immunocompromised neonates aggregated in the same location with a lot of salmonella strains and a lot of other pathogens. So infectious disease nightmare, right? So if I had to design a system to spread infectious diseases around, I think this is the one I would design. Immunocompromised neonates aggregated in the same place with high exposure to pathogens. So livestock auctions, this is just the nature of the beast. This is the structure of the industry right now. So in this scenario, for some type of salmonella is out there for sure. Salmonella Dublin, on the other hand, is not fortunately everywhere. We failed to detect it in these livestock auctions. Is that because it wasn't there? Probably not. We were using culture, and as Adriana can tell you, it's hard to culture out Salmonella Dublin. It doesn't like to grow in the laboratory. So our sensitivity for diagnosing Salmonella Dublin in these environments was pretty bad. Right, so we came up with 0, but it doesn't mean it wasn't there. Did a different project. We were working in a slaughter plant, collecting lymph nodes from calves that went to slaughter. And there were 3 different systems that we'd sampled. And in this case, culture from tissues rather than boot swabs worked pretty well. And some of these systems had a very high prevalence of Salmonella Dublin, whereas this system 1 in Canada had a very low prevalence. So the organisms circulating quite well, being transmitted between farms in this system 2 in the USA. And then in this system 1 in Canada, they've done a much better job with prevention of circulation of this organism. So the prevalence was a lot different depending on which system that we went into. This is some more epidemiologic research on Salmonella Dublin. So this is out of Canada, and they tested 100 herds for antibodies to Salmonella Dublin. And they were looking for the prevalence and then the risk factors. So for the farms that are positive, how are they different from the farms that are negative? And so they had found at least one animal in 25% of those Ontario dairy herds. And then they found 4% of the herds were positive for bulk tank. So suffice to say, there are a lot of farms that were successfully excluding that pathogen from their farm, right? They were doing something right because Salmonella Dublin was not on their farm. Whereas other farms had not been so successful, that Salmonella Dublin had found their way onto their farm in some manner. All right. Anybody have any guesses on how these farms that were positive are different from the farms that were negative? Nobody's brave enough to guess? That's okay. I'll get to the punchline. All right. So Salmonella Dublin is unique from every other strain. We have these latent carriers and cycles of infection that make eradication from the farm really, really, really difficult. Really difficult. Treatment with antibiotics is generally not very rewarding because of antibiotic resistance and some other reasons. And we know that Salmonella Dublin is not on every farm. All these things point to a prevention approach, right? We got to keep it off the farm. So, and that's biosecurity. All those methods that we can keep an organism from coming onto the farm. So for Salmonella Dublin, I've alluded to this already. There's direct transmission, so transmission between calves. So 2 calves are in the same pen. 1 calf is sick. I mean, it's excreting the organism in the feces, in the respiratory discharge, and it could transmit it to another calf. There's indirect transmission. So a sick calf could contaminate the milking equipment, the waterer, something along those lines. And a susceptible calf could get exposed and get sick that way. And then there's vertical transmission. So these are common transmission routes for a lot of different pathogens, but these are the 3 primary ones for Salmonella Dublin. So knowing that, then we can troubleshoot when we're on the farm, how do we disrupt this transmission? How do we make this less likely? So from a biosecurity standpoint, we talk about external biosecurity and we talk about internal biosecurity. So external biosecurity, so how do you prevent the introduction of the pathogen onto the farm? How do you keep it out? Right? Because the farms have to engage in commerce. They can't put up a moat and not allow animals in or out or equipment in or out. They have to be able to move things around. So how do you do that in a way that makes it less likely that those pathogens come onto the farm? Can you mitigate that risk? And then internal biosecurity, how can we prevent the transmission of the pathogen within the farm? So assuming that we have it on the farm, what practices can we put into place so that we make the damage less severe? All right, so how does Salmonella Dublin get onto the farm? This is some of that epidemiologic work that I had mentioned before. So the herds in Canada, and I asked you how some herds that were positive might be different from herds that were negative. Not surprisingly, so the herds that were positive for Salmonella Dublin had at least one new introduction into the herd in the last 2 years, right? So they took an animal from an outside source, from another farm, from an auction, and they brought it onto the farm. And when you do that, you're rolling the dice. Like, what does this animal have? Best practices, of course, best practice would be to quarantine that animal for a few weeks, make sure that it doesn't break with disease, but that's often not done. So regardless, herds that had one introduction in the last few years had 2.3 times the odds of being positive relative to herds that didn't do that. So this is good evidence that farms should really pay attention to how they're bringing animals onto the farm. Another risk factor, not surprisingly, was at least one animal left the farm and then came back. Why might an animal leave the farm and come back? They show an animal at the fair. That's one reason. Yeah. Some farms use contract growing, right? They'll send the heifers, the calves will be born on the farm, but they'll get transported to a contract heifer raiser and then come back to the farm when they're ready to have a calf and start milking. So a lot of different reasons why an animal could leave and then come back. But of course, once the animal leaves, it could get exposed to Salmonella Dublin, it comes back, then it brings it back to the rest of the farm, right? So these are not surprising risk factors, but solid epidemiologic evidence that farms should really focus on those aspects of biosecurity. We tracked some movements of surplus calves, and the calves are moved around a lot in the Midwest. So when I say surplus calves, I'm referring to the male calves born on dairy farms that are not retained in the herd by the farm, right? Those get sold, as I'd mentioned, sometimes through the auction, sometimes through other ways. But a lot of them, for instance, that are born in maybe New York, get transported to the Midwest to be grown by a calf raiser. So there's a 12, 14-hour trailer ride is not uncommon. So there's this whole host of animal welfare issues surrounding that I'm a collaborator on with animal welfare scientists about how we can make this an appropriate welfare experience for the cows. So it's certainly challenging. So I'll skip through some of these a little bit. So external biosecurity. So if you're designing a biosecurity plan for a farm, you're thinking about all the potential ways that a pathogen could come onto the farm. So you might think about who has access to the farm, how are they getting in, how can we control that access? So for instance, if there's an individual that was working on another calf farm, managing an outbreak of Salmonella Dublin, probably wouldn't send them an invitation to come to your farm, right? Because their clothes, their boots, everything else could be contaminated with that pathogen, and then they could introduce it to your farm. So the more you limit access to your farm by people, the more you mitigate that risk. There's animal movements, which I already mentioned, which animals are coming onto the farm. There's wildlife control. Birds can be vectors, rodents can be vectors for Salmonella Dublin. So a part of the biosecurity plan is to reduce the likelihood that rodents and birds and everything else are coming into contact with the animals on the farm. There's testing new introductions, right? So if you have to bring in animals onto the farm, maybe there's a way to test them to make sure that they don't have the pathogen that you're concerned about. So on farms, I mean, there's different ways of identifying pathogens. For Salmonella Dublin, there's an ELISA to detect antibodies. There's culture, where we actually grow the organism in the laboratory. And then there's PCR, where we're just detecting genetic fragments. I'm sure this terminology sounds familiar to a lot of you. So this is terminology that's common for infectious diseases more broadly. So for the ELISA, right? So this is pretty useful. We can detect long-term carriers, but an antibody, of course, means they had an infection at any point in the past, right? At some point in the past, their immune system responded to an exposure to Salmonella Dublin. And so you have to take that into account when you interpret it. The other disadvantage is that many cattle producers are vaccinating for Salmonella Dublin, which is an exposure to Salmonella Dublin that the immune system responds to produce antibodies. And so if we have a positive test on an antibody from a farm that's vaccinating, it's completely meaningless, right? Because we can't really know if that was an exposure to Salmonella Dublin or if it's just because they happen to be vaccinating for that particular pathogen. And then the other problem is that it's kind of a crappy test because it doesn't do a very good job of detecting all animals with antibodies. It doesn't have a very good sensitivity. We did a small trial, and we used several different vaccines for Salmonella that are commonly used in calf production systems, and we measured the antibodies, and we showed that for some of the vaccines, the animals are positive at 2 weeks and at 5 weeks on this antibody assay. Some of them are, but not all. So we vaccinated 10 in each group, and for instance, for intervene D, only 5 out of the 10 seroconverted, only 5 produced antibodies that were detectable. So culture is another option for detecting this pathogen. It works really well for active disease. If they have clinical signs, diarrhea, respiratory disease, then we can find it on culture. And if we have the actual organism in the laboratory, at the diagnostic laboratory, then we can subject it to antimicrobial susceptibility testing and see which antibiotics it's susceptible to. I mean, I showed you that panel of antibiotics. So that's only possible if we actually have grown the organism in the laboratory. Disadvantage is that it's really insensitive for long-term carriers and it doesn't detect environmental shedding very well. So that's why we went to PCR. So PCR is the assay that we've developed is specific to Salmonella Dublin. It's not expensive, it's more sensitive. And we trialed this out on dairy beef farms and in calf dealer environments. And when we sampled at the calf dealer, we found about 22% of the samples were positive based on PCR and 0 of them on culture. So we had a test that was much more sensitive for finding Salmonella Dublin relative to culture. Same thing for dairy beef farms. We found it in 26% of those boot swab samples, Salmonella Dublin, but only 4% on culture. So much more sensitive. So because of the test, a farm could decide if they have it or if they don't. Or if a producer was considering buying animals from a farm, they could, once we have this test up and rolling, use this as a factor in the decision making on whether or not to bring animals from those farms, right? You wouldn't want to bring animals from a farm that was Salmonella Dublin positive. So I mentioned internal biosecurity, and that is how we keep infections from spreading within the farm. So another result of that epidemiologic study was that farms that had less frequent cleaning of the maternity pen where the cows were calving out or they had a higher concentration of cows in the maternity pen were more likely to have at least one animal that was Salmonella Dublin positive, right? So there was a good epidemiologic evidence that producers should focus a lot of efforts in making sure this calving pen is super clean, because that's an area where calves can get exposed to the pathogen and get sick. And if there's a cleaner environment, then that's just less likely to happen. So a good example of a measure that's good for internal biosecurity. All right, so in general, this is how I'm thinking about controlling infectious diseases on farms. So on one axis, we have resistance to disease. So the individual calf's ability to fight off an infection. So their immune system, the level of stress that they have, their nutrition, whether or not they've been vaccinated, all those things that go into whether or not they can respond effectively to an exposure to Salmonella Dublin, right? How resistant are they to Salmonella Dublin? And then on this x-axis, we have the degree of challenge that the calf might get. So they might get a really high exposure to Salmonella Dublin. They might be exposed to a lot of Salmonella Dublin, and the dose matters. Or they might get exposed to a very small amount. If you stay above the line, you're generally preventing disease, right? So if you have animals that are very resistant to disease that get smaller doses of the microorganism, then you're going to be successful. Does that make sense? So when we're walking through a farm, we're looking at ways to increase resistance to disease, husbandry practices, nutrition, vaccination, that sort of thing. And we're looking at ways to decrease the challenge that the calves are exposed to. So internal biosecurity measures, cleaning the maternity pen, cleaning and disinfection, all the infection control protocols that happen within the farm. This is the paradigm that we have for prevention on the farms. And producers will pay for this, for sure. For veterinarians that are skilled, know the production system, understand epidemiology and infectious disease transmission, and use data, they will absolutely pay for this. So, for example, improving calf resistance, colostrum protocols, nutrition, vaccination, stress reduction, and then decreasing the challenge, as I mentioned, internal biosecurity protocols, external biosecurity, manure management, housing. So in a calf production system, so this is one of the systems that I've worked with. This is a row of calf stalls. So they're individual housing. There's a calf in each of those stalls with a feed and a water bucket right in front of them. And there's one of the internal biosecurity measures would be all in, all out. Anybody want to hazard a guess of what that means? Some brave soul will be the first one to answer a question. Yeah, go ahead. Good thought. So she said shower in and out. Not in this system. You do come across that in swine and poultry production systems where individuals are required to shower in and out. But when I say all in, all out, I mean something different. Yes. Perfect. Yes. If they come into this, if it's time for the calves to leave, they all leave, right? Because sometimes I would talk to a calf producer and I say, Art, do you guys use all in, all out? He said, yes, Doc, definitely. We use all in, all out. But then I'd say, well, what's this calf here? It's the only one here. Well, that calf wasn't growing very well. So I thought I'd keep it around for a little while longer to give it a chance to grow longer, right? But really bad idea, because that could be the typhoid Mary, right? It could be, there's probably a reason that it didn't grow very well. So get them all out, right? Clean and disinfect, break the cycle of infection, let it rest for a couple of weeks, and then you can start bringing in new animals. So in this type of calf production system, and in swine production and in poultry production, this is one of the hardcore principles for infectious disease control within these production systems, to break that chain of infection by using an all in, all out system. So another one, carcass disposal. So every once in a while, they have a calf that doesn't make it, right? Maybe it gets infected with Salmonella Dublin and they don't successfully treat it. They have to have a plan to get rid of that, right? This isn't a carcass that is teeming with infectious pathogens and waiting to be transmitted to another individual. Once I watched a worker take the calf out of the stall, drag it all the way down this alleyway, right? Drag the dead calf that had died of salmonella bubbling all the way down the alleyway. There's calves on both sides. You see the problem in this thing, right? Okay, good. So there's alternatives to that. I said, look, there's a rusty wheelbarrow over there. Why don't we put the calf in the wheelbarrow and then wheel it out to where it needs to go without dragging it down? So it's not hard, right? These are things that are not rocket science. They just have to have a plan in place, and they have to be thinking about transmission of pathogens when they're going about their daily activities, and oftentimes they're not doing them. Restricted personnel. So if you have a barn that has the most susceptible animals, the baby calves, for instance, you might think about, well, not everybody needs to be going through here, right? Not everybody needs to be walking through this barn on their way to lunch. So we can restrict this to only the people that need to come into the barn, just to make sure it's less likely that somebody's not tracking in something. Wearing gloves is something that we would ask folks to do a lot. So if they were working calves, vaccinating, feeding, whatever, if they got their hands dirty, they could quickly switch out gloves and be less likely to contaminate calves. Order of operation. So if they were vaccinating, we'd always ask them to do youngest to oldest. Any guesses on why we want to go youngest to oldest when we're vaccinating and not oldest to youngest? Yes, sir.
Is it because the younger ones have like a weaker immune system?
Yes, perfect. The younger ones have the weakest immune system. The oldest animals are most likely to be shedding the organism. So if you go from oldest to youngest, then you're shoveling the pathogen down the hill towards the most susceptible individuals. If you start with a clean pair of coveralls and you work with the youngest animals first, and then you can prevent some infections. And then really, obviously, but not obvious to some, is working with the sick calves last, right? If you have on your chore list to feed the newborn calves and treat the sick calves, you don't treat the sick calves first and then go feed the young calves. You feed the young calves first, and then you go treat the sick calves and potentially change out coveralls while you're doing that. Right, so a lot of kind of general infection control principles that could have a big impact. It's not rocket science. You just have to have an understanding of how the pathogens could move around. I tell you what, though, farmers a lot of times they don't want to hear that stuff. That's hard, you know. External, internal biosecurity, that takes a lot of effort, coordination, communication, signage, protocol writing. More often, they're going to say, "Doc, what can I give to the calves to keep this from happening? A vaccine or an antibiotic?" And there are vaccines out there for salmonella. There's lots of companies that will produce a kill vaccine and sell it, and there's absolutely no efficacy data on it. There's plenty of vaccines out there that there's no efficacy data for. A lot of these salmonella vaccines, Salmonella Dublin Intervene D, for instance, this one is probably the most used vaccine. And I'd say 60 to 70% of the calf production farms in the United States are using it. There's only been 3 randomized clinical trials that would assess the effectiveness of this vaccine against Salmonella Dublin. And 2 of them, one of them I did when I was a graduate student, there was no difference in mortality or growth or any of the health outcomes. And in one of them, there was a moderate reduction in mortality. It was something like 14% versus 10% during an outbreak, right? So pretty modest. Vaccination is something that producers want to do because they can do it pretty easily and in a short amount of time. But this is one of those problems that they have to do the hard things. They're not going to be able to vaccinate their way out of it. I'd mentioned that we use PCR to identify Salmonella Dublin on the dairy beef production systems using boot swabs. And when they were there, they walked around the pre-weaned calves that were still on milk. They went into the milk mixing room, and then they went into the post-screen calves and walked around there. And then we cultured out those boot swabs separately. So you can see that the most commonly positive boot swab was for the milk mixing room, where they're mixing up the milk, right? You see the problem here, right? So folks are tracking in Salmonella Dublin into the room where they're preparing the milk to be fed to the calves. So clearly there's some opportunities for cleaning and disinfection within that room to prevent new infections. And we've developed fact sheets and such to help producers do this the right way. From human nature standpoint, folks look for the easiest way to do this, the shortcuts. And so having these steps in place, these standard operating procedures is useful just to make sure it gets done the right way. Another aspect of internal biosecurity was selecting the right disinfectant. We did some research that looked at the efficacy of different biocides, different disinfectants for killing Salmonella Dublin. I won't spend a lot of time on this, but there's a lot of factors that influence cleaning and disinfection. So one of those is the type of biocide, the concentration of the biocide, and the contact time. And that's specifically what we were looking for. So one of the disinfectants that we tested was called chlorine dioxide, very commonly used disinfectant. This arrow is pointing to the highest end-use concentration suggested by the label. So essentially, in the laboratory, we're replicating this concentration of the biocide in a petri dish, adding Salmonella Dublin to it, and seeing if it does, like it should, at that concentration. Not that complicated, right? The concentration that was required to actually kill Salmonella Dublin with this disinfectant was over 3,000 parts per million. Right, so this concentration of that disinfectant was not killing Salmonella Dublin. We were still able to grow it after exposure to that disinfectant. So the choice of the disinfectant is really important. Fast forward a little bit here. So Virkon, just to contrast that with chlorine dioxide, the concentrations that we tested were very effective for killing Salmonella Dublin. So this is information that we can deliver back to veterinarians, back to producers, and say avoid one particular type of disinfectant because you're not doing anything, and use this other disinfectant where you're going to be much more effective at, for instance, cleaning and disinfecting the milk mixing room, right, where we're finding Salmonella Dublin. All right, so this is all the advice that I would give to producers, right? Create a biosecurity plan, both external and internal. External, how are you going to keep it out? Internal, how are you going to keep it from spreading within the farm? Consider testing new introductions if you have to test introductions. And then the maternity pen is worth investing effort into to keep that clean, to keep new infections from happening in the baby calves. And then one of the other tendencies for the producers was to apply a disinfectant to a surface or to a piece of equipment without actually cleaning it first, right? Not effective because Salmonella produces biofilms and it protects the bacteria from that particular disinfectant. So they really have to clean that with soap and water and scrub it and then apply the disinfectant. So all those things kind of go into a good prevention plan. So from a research standpoint, we focusing a lot on how to identify the latent carriers. There's a lot of lack of understanding for the frequency and duration of shedding amongst those latent carriers and other potential sources of infection. And then we're also working on designing optimal cleaning and disinfection procedures that take into account the biofilms that are produced by Salmonella. So yeah, that's what I have. Questions can I answer for you guys? Yes, sir.
So is it common for this to transfer from cows to other animals on the farm, or is it just kind of?
So the question is it common for this organism to transfer to other animals on the farm? If they are cattle, yes. Right. So Salmonella Dublin is something that is pretty specific to cattle. Occasionally it causes disease in other species like humans, but usually it's cattle. Right. So when we want to, if we're thinking about reducing infections in people, then we're focusing on cattle. So poultry, swine, generally not susceptible to Salmonella dublin.
And also, if it doesn't affect the human, does it ever go latent in people or no?
Does it ever go latent in people? That's a great question. I don't think it does. It has, like I said, a predilection towards cattle, and that's why you can set up shop inside a cow. But I don't believe that. I've never heard of a latent carrier of a person in people. Now, what Salmonella dublin is to cattle, host specific, Salmonella typhi is to people, right? So I mentioned typhoid Mary. So that's the latent carrier, is Salmonella typhi in people. So that's a human organism. So Salmonella dublin produces latent carriers in cattle. Salmonella typhi produces latent carriers in people. Yeah. Good question. I really have no idea how I got here. How did I get involved in this type of research? So I spent 3 years in practice. I mentioned that already. And 3 years into practice, I liked it. To be honest, I didn't love it, right? And I also recognized the value of epidemiology and prevention. And so I was kind of looking for something more. I left practice and did a dairy production residency at Michigan State University, where I worked a lot with dairy farms. That led into a master's degree, which was focused on antibiotic resistance and zoonotic pathogens, which led into a PhD in the same topic, which led to me coming to Ohio State for this particular job. So mine was a very winding path. It was not an intentional. I was in vet school. I just wanted to do mixed animal practice, and I didn't have an intention of being an academic. But that it turned out that's the right spot for me. So in vet school, so I love research, right? That's the right spot for me. I love researching infectious diseases, taking a One Health approach. I didn't really get a lot of research experience in vet school or prior to vet school. So my research experience came during that master's degree, and that I really liked it. I learned that I loved it then, but not earlier to it. So somebody like yourselves, you could get a lot of diverse types of experiences, right? Really understand what's the best fit for you, and you could be more intentional about your career path. So there's definitely the opportunity to do that. For most people that I talk to, they still have the winding career path, right? They still don't really learn what drives them until they actually go out and do it. So it's not an uncommon situation at all. What other questions? I really like working with graduate students, right? So graduate students that are motivated to answer a specific research question, that are really passionate about the science behind it, occasionally falling down scientific rabbit holes about certain questions. So I enjoy that a lot. Teaching, I enjoy teaching in the vet school curriculum. So I teach epidemiology and food safety and disease prevention in the vet school. So yeah, it's an easy one. Thank you. There's somebody else. Yes, sir.
So,
Presumably Ireland. So they named it after their location. That happened with a lot of the Salmonella serotypes. There's Salmonella Kentucky, Salmonella Newport. So yeah, my honest answer is I don't really know where it originated, but I assume where it was first isolated, characterized was somewhere in Dublin. Yeah. Yes.
Just because I'm like kind of interested.
Yeah. Oh, good. I liked it. So I'd go out and do farm calls in the morning usually. And, we'd see sick cows, do surgeries, do a bunch of preg checks. And then a lot of times I, get out of my coveralls, change clothes, and then see small animal patients in the afternoon. So in that respect, like the variety was really cool. I think a mixed animal practitioner might be the hardest job there is. I think it's easier to specialize because it always felt like I was really striving to be as good as other veterinarians that I knew were doing small animal practice, right? I felt like didn't feel inadequate, but I always felt like I was a little bit behind the 8 ball because I was spread out so thin in terms of my practice and expertise. Recognize I had 3 years, right? So maybe that would resolve had I stayed in practice for longer, but really appreciated the variety. But it's super challenging to be a jack of all trades and not a master of one. Yes.
Since it was a general practitioner, have you ever found yourself working with like the ODA and the USDA and the FDA in terms of regulation and biosecurity standards?
All the time. Yeah, all the time. So that's a strength of our department at the college. So the Department of Veterinary Preventative Medicine, we interact with especially the folks at ODA and the USDA a lot in terms of infectious diseases. And so in our department, we have individuals that are working with everything from methicillin-resistant Staph aureus to high pathogen influenza to coronavirus in deer. Right, deer are a reservoir for COVID, and so that's why our department exists, is because infectious diseases are transmitted from animals to people. Pandemics come from animals, right? So if you can name a pandemic where that pathogen did not originate or get transmitted from animals, whether that's coronavirus, avian influenza, that's why our department exists, is because we're part of working to prevent pandemics and disease prevention. So most emerging infectious diseases are originating or directly transmitted from animals. Tuberculosis, brucellosis, antibiotic-resistant bacteria. There's many more. So lots of opportunities in preventive medicine, not just production agriculture, but in preventive medicine and infectious diseases.
Thanks so much for coming. If anyone has any questions, we'll be here for a little bit. If you haven't picked up your merch, grab it. If we don't have your merch now, like I said, if you want to get it over final, Michaela can bring the time, but if not, we'll give it to you the first meeting. Good luck with your exam. Have a good break.
Yeah, thanks for having me.
Yeah.
Appreciate it.
We don't really get a lot of like research driven people, so that was really good. Thank you.
We'll talk to you later.
Yep, see ya. Thanks.